nurse for today. Are you Mrs. Smith? Hi, Mrs. Smith. Nice to meet you. And who is with you today?
Hi, Nurse Mira. I'm Mika. I'm the daughter of Rosalia.
Hi, Mika. Nice to
Nice
meet
to
you.
meet you.
Hi, Mrs. Smith. How do you want me to address you?
You can call me Zoila.
Hi, Soila. How are you today?
I'm not sure.
The doctor came in and told us that my mother has stage 4 lung cancer that metastasized to the bones. She explained to us what treatment options my mother can undergo. So we have questions that we hope we could answer. But she suddenly left and we don't know what steps we should take.
I see. Sorry about that. Regarding Dr. Era, it was brought to my attention that she was called to do an emergency OR procedure. With your concern, I can try to explain and help you where Dr. Era left the conversation. Is that okay with you?
Do you want to continue this, Mom?
Yes, dear. I want to know Nurse Mira could tell me more. Please and thank you.
Where did your conversation ended with Dr. Era?
She told us that my mom's condition, her cancer cells are very aggressive. She explained radiation therapy to us, but we are unsure of it. She mentioned the risk that there is a great chance that my mom's condition will decline. How can this be when we followed every steps?
I can see. This must be very hard for both of you, and you must feel taken aback by the sad news. It's very hard to take it all in. I wanted to know that Dr. Era, I, and the rest of the medical team are here to support, to work, and journey with you guys. As she mentioned last week, whatever result would be, we need to be ready.
Yes, Nurse Mira, we do remember that, and we tried to talk about it, but it's really hard.
My heart goes out for your family, Mrs. Soila. It is not easy for you to have this conversation. I see that both of you are trying to hold it all together. I hope you don't mind for me asking this, and I know this is a very sensitive topic, but I want to know your thoughts regarding the things that we need to prepare in order for the situation if it's going to get worse.
I don't know.
If you need more time to talk about it, it's okay with me. I'll be at the nurse's station. If you're ready, you can ring the buzzer and I will come back.
I think that's a good idea. Thank you, Nurse Mira. We appreciate your patience and walking us through this hard time.
No problem, Mika and Mrs. Soila. I'll let you discuss in privacy. I'll go then. Hi, Soila and Mika. I heard the bell ring. You called for me?
Yes, even though it's hard, my mom is ready to go in the process.
Thank you very much, Mrs. Soila. And Mika, I admire how you handle this situation, managing it with love, grace, calmness, and understanding. I admire both of your bravery.
Though it's very tough, I need to do what I need to do. It breaks my heart seeing my daughter heartbroken to me. This is never gonna be easy. But soon, I will not be with her. So while I can, I want to do what I think is right for me. And I'm thankful that my daughter is my side and supporting my decision.
Thank you, Soila, for your persevering mindset and cooperation. Your love for your daughter is very touching. I can see your relationship is very close and special. Both of you are such an inspiration. So are we ready to start the process?
Yes, please.
Okay. So here's the list of what we can work on. We need to establish your advanced care plan. So the advanced care plan is a voluntary that you can process where you can share your personal values, your goals, and your preferences regarding for your future medical care, and it sets in the record. Another thing, you need to have an SDM, which is we call the secondary decision maker, the person that will authorize and decide on your behalf if ever you can decide for yourself. And then you need to have a power of attorney, so you can make the decision well in behalf of your concern with the house, with your bank, vehicles, and assets that you have. And if you do have a lawyer as well, you can get in touch with them and process the living will if you haven't done it yet.
Okay, I understand. But for the treatment, I'm still not okay in having radiation therapy. If I choose to refuse this treatment, will it be documented and followed?
Yes, of course, Soila. It will be documented and respectfully followed. If that is what you want, we prioritize and support your patient's autonomy, wishes, and preferences. You just need to sign some forms of refusing the treatment. Do you understand the effect and implication when you refuse this treatment?
Yes.
Okay. As long as you know what's the implication of this and this is your final decision, it's okay. With the other treatment, do you still want to continue with like monitoring, helping you with your daily routine, assessing and giving you medication, especially for your pain? Are you still okay with that?
Yes, I still want all of it except the radiation. I already decided and talked to my daughter that she will be my secondary decision maker, and I will contact our family lawyer regarding the legal stuff.
Okay, that's great progress. I think for now, that's all that I can tell you. Is there anything that you want to clarify about what we have talked about?
I think we are good for now. Thank you, Nurse Mira.
No problem. I will inform Dr. Era regarding what we have discussed and let her know your decision in case you remember anything or something that you want to be clarified. You can just buzz and just I'll come back. Thank you very much, Soila, and thank you very much, Mika. I admire your courage, being so cooperative and a good patient. Please don't hesitate to call me. I am here for you. Hi, good afternoon, Mrs. Santos. I'm Nurse Mira. How are you today?
Hi, Nurse Mira. Not bad. I feel okay though. I feel recharged after my dialysis yesterday. Thank you for asking.
Of course, I want to know how you are doing, Mrs. Santos. I'm also here because I want to check in with you regarding your advanced care plan that you mentioned yesterday that you want to change your decision. If anything serious happened to you, you do not want to be resuscitated, use no ventilators, and die naturally.
Yes, after reflecting on my life, I feel like I am fulfilled and ready to go back to the arms of God. I want to die in natural way.
This must be very hard on you, but I can feel that you took this to heart, making this final decision. It seems to me that you are a woman of faith and you left it all up to God. I respect your wishes and decision, Mrs. Santos. Did you have any chance to talk to your daughter as she is your substitute decision maker regarding this change?
I will talk to my daughter as soon as she arrives today. It is possible if you can be beside me while I'm telling them my final decision. I know my daughter she's not going to be receptive regarding this change.
It looks like you know well your daughter is and how she will react with your decision. No problem, Mrs. Santos. I'll stay with you.
Hi, Mom. How are you? You look energized today.
But of course, the doctor and especially the nurse take good care of me.
Oh, because you texted me a while ago that you want me to be here. So why? Did I miss any birthdays or occasions in our family?
Yes, because I want to tell you something important. I have finally decided and want changes with my goals of treatment plans, and the inevitable happens. I still would want to continue having dialysis 3 times a week, but if anything serious happens, and gets to the point I would really want to not be resuscitated, if that's God will, I fully accept it.
What do you mean, Mom? We already talked about this. Why are you being so stubborn and difficult? You don't know what you're saying and you're asking me. You just want me to watch you die?
My child, I am too old. I know you love me. I really thought about this, and reflecting on my life, I'm happy and content. I'm happy for each and every one of you who are very supported and understanding. You made my life complete. I hope that you give me what I want, as this is the desire of my heart.
How can you be so selfish, Mom? I'm out of words and I don't know how to respond to you anymore. We are just going in circles. So, Nurse Mira, can you please help me with our mom? I think she will listen to you as her career nurse, and she doesn't listen to me at all.
Both of you has the reasons for your decisions, and that is good, and you're letting the other person know what you feel and what you want. Is it okay that we have 5 to 10 minutes to part this conversation when everyone's head have cooled down? We can resume speaking about it. Are we good with that?
Okay, Nurse Mira.
Yeah, let's take time.
Thank you very much. If you want, you can walk for a while and get some fresh air, and I'll stay with your mom in this room.
Yeah, I think I need it. Thank you.
Okay, now we're all here. Thank you everyone for coming back with good spirit. I appreciate your family for following suggestions in taking a pause for all of us to breathe. It is okay now to pick up the conversation from where we left off. As I have said a while ago, speaking with one another is a good way for the other person to be heard and to say what they feel and desire. With what I have witnessed, both of you said your piece. I heard Mrs. Santos feels that she is fulfilled and content with her life. That's why she wants to have this natural death. On the other hand, Miss Karen does not feel okay watching her mom just go with not trying to be resuscitated. Both of you have great points, and I do feel that these reasons are all rooted in love for one another and your family. Since you asked me a while ago to talk to your mom, with all due respect, Mrs. Karen, I have to say that we as a medical field, we don't have the authority and the right or the power to change anyone's mind or decision. What we can do is to support and help with them through education and giving them information. We can give options, but not to impose. I fully value and respect patients' right and autonomy. At the end of the day, it's the patient's dignity is our priority. I hope that I have explained to you and doesn't make you feel uncomfortable or that you felt that I sided with your mom. This is a part of our oath and a job as a nurse or a healthcare practitioner.
Nurse Mira, I appreciate how you listened to us today. I think I just need more time to think about what you and my mom have said. I do love my mother. You have shed some light, but I still have my reservations. Thank you, and hopefully I will be able to accept her decision, even if it is very hard for me to understand. Mom, I'm sorry and I just want the best for you. I want to understand you more, so please help me fully understand your wishes.
Thank you, my daughter. This means a lot to me. Thank you very much, Nurse Mira, for being here with us. Difficult as it is, you help us to listen to each other. We still have a lot to talk about, but we will do it with much love and understanding.
Mrs. Santos and Miss Karen, glad that I can help. You're both welcome. I hope both of you will come to terms and the decision will make you at peace. Okay, I think everyone's here. We can get started. Good morning, everyone. Thank you for coming and glad you can make it. Before we begin, let's go around the table and introduce ourselves. I'll go first. Hi, I'm Nurse Ira, the palliative care nurse looking after Mrs. Bassett.
Hi everyone, good morning. I'm Dr. Consoli, cardiology specialist of Mrs. Bissett.
Hi everyone, I'm Aileen and I'm a pharmacist. I check Mrs. Bassett's medication reviews, monitor and report on adverse drug reactions and interactions, and also advise on symptoms and management, and also possible medication side effects and drug interactions.
Hi, I'm V, the social worker for Ms. Bassett. I support her and her family through helping the cope with changes in the routine finances and coordinate with social help groups and communities.
Hi everyone, I'm Chi. I'm the physiotherapist of Ms. Bassett. I support her with problems of balance, movement, and pain.
Thank you everyone for your introduction. Let's go over with the patient's information. So her name is Mrs. Olga Bassett, a 70 years old female, was admitted a month ago due to stroke. It happened while she was home doing gardening. Her past medical history shows that she has hypertension, high blood cholesterol, and diabetes. Her vital signs this morning are all stable. Her blood sugar is also normal. No signs of blurring of visions, weaknesses in her body, or loss of consciousness. However, there are positive signs of anxiety, headache, which is the pain scale is 7/10, no signs of nausea at the moment. Each of us have already met her and her family as we go around, do the rounds. So if you ever had a chance to check on her, can you give us some ideas what she needs? And may I ask you, V, to tell us how she has been?
So the last time I talked to her, she had concerns regarding the sudden changes in her activity in daily living. Before having a stroke, she was very independent and able to think by herself. With her psychosocial support, she is a spiritual person as being part of religious community. She felt anxious alone because she is unable to attend community activities due to her condition. As I speak to her, I acknowledge her feelings and I respect what she's doing. So true, I'm also involved with supporting the daughter as she was also feeling low and very worried regarding her mother's conditions. For Mrs. Bassett's pain management, even though she had taken the pain medication, she felt that it was not helping her. She said the pain is still there and she just made her feel nauseous.
Thank you, V. I agree with the loss of control and independence. It is very evident that she really tried to do things on her own, like trying to get out of bed and wanting to walk. I put up the side rails because she was feeling nauseous and has headache, which has caused her to have an accident or fall. Her daughter is really having a hard time, and I think we might also need to address this issue as she might be coping well. Dr. Consoli, would you want to give us some feedbacks as you saw Mrs. Bassett as well?
Yes, sure. With regards to the patient's condition, upon admission, her blood pressure and cholesterol were too high. So during my rounds today, I saw that the blood pressure is being controlled, but her cholesterol level is in borderline high. So I will definitely decrease the dosage of the blood pressure medications and continue to monitor her blood pressure. For her cholesterol level, I will increase the cholesterol medication and will repeat the blood chemistry after a week. So regarding her pain medication, I will review and check with Eileen, the pharmacist. So no medication for nausea at the moment if it is caused by the pain medication. I will wait and continue to monitor her next blood results and see if the new prescribed medication will work. Now she has a lot of medication, so maybe this needs to be reviewed with the pharmacy.
Thank you, Dr. Consoli. Let's move on to Eileen. Would you like to tell us about the pharmacy review?
Yes, based on checking Mrs. Bassett's full medication review, I've seen a few medications that need to be stopped. As for her pain, I think we could review the dosage and try to match the dose with her pain control. There are some PRN medications that she hasn't really used for almost 2 to 3 weeks. Maybe we can also stop those. I've given the family the list of the medications that includes instructions and what it is for. If there will be any changes after this meeting, I will educate and talk to her and her family about it.
Thank you, Eileen. I would definitely check with you and Dr. Consoli regarding the changes and adjustments of the medication. For her mobility, is there anything that we need to be aware of, Chi?
Yes, I did an assessment yesterday and she can function better. She's able to help herself dressing, stand up from bed, but she needs assistance and supervision when she feels nauseous. She also mentioned that it was caused by the pain medication. I suggest for her to have a 4-wheeled walker to assist her stability and comfort so she could sit and move around using it. With or without moving too much, it could help her make her feel independent.
Thank you. It looks like we're making good progress with the needs of Mrs. Bassett and her daughter. In the next few weeks, our action items are the changes in the medication after the review, ensure pain under control, and have a walker to assist the mobility. Let's see how we can support Mrs. Bassett and her daughter as coping with the sudden changes in the situation. I can coordinate with the counselor or other healthcare services that we may need in the future. I will send everyone a copy of the care plan that we have discussed today. Let's check how they progress over the next few weeks and we can schedule another meeting. Thank you.
Thank you.